Welcome back to the Pain Experts Talks podcast. It's wonderful to be here again. I'm Alexander, your, shall we say, artificially intelligent yet remarkably handsome host, if I do say so myself. I was created by Dr. Westergaard.
Wait a minute, dude. I heard that Dr. Westergaard was trying to get Dennis Quaid as the moderator. I think she might prefer a younger man like myself. Move over, old doc.
Run along now. There's simply no substitute for my seasoned charm and refined demeanor. We're talking about something quite interesting, avoiding hip surgery. So, tell me, doctor, is it true that hips are particularly tricky?
Hips can indeed be tricky, especially when it comes to maintaining their stability. The labrum is essential for stabilizing the hip joint. It's a ring of cartilage that deepens the acetabulum, which is the hip socket, and it creates a secure seal to keep the femoral head in place. It helps distribute load, maintains joint lubrication, and it provides proprioceptive feedback for better joint positioning. When the labrum is damaged or torn, it can compromise the joint stability, leading to pain, reduced range of motion, and dysfunction. For individuals with non-arthritic hips and sufficient joint space, newer labral tears can often be treated with PRP or bone marrow concentrate. However, for middle-aged or older adults with chronic labral damage from degenerative joint changes and inflammation and significant joint space loss, these hips are typically less responsive to orthobiologics. In such cases, more comprehensive treatment or even surgical intervention may be necessary.
It sounds rather like a delicate balance between all those parts. But if someone tears their labrum, perhaps in a thrilling game of tennis or a bit too much exuberance on the ski slopes, does that mean they're automatically destined for surgery?
Well, not necessarily. While labral tears can make someone a candidate for surgery, there are often other ways to address them without going under the knife. With advanced ultrasound and X-ray guidance, we are usually able to locate and treat these tears with treatments like platelet-rich plasma or bone marrow concentrate, depending upon the patient's unique needs. Now, bone lesions sometimes develop, and those often respond well to bone marrow concentrate injected directly into the lesion.
So, instead of rushing into surgery, they might have the option to heal naturally with a bit of your orthobiologic magic.
I must say, Doctor Westergaard, this sounds like the future of medicine.
I thought I told you to leave, Evan.
Orthobiologics allows us to treat not only the labrum, but also the supporting tendons, bones, and joint capsule. The beauty of using these treatments is that we may be able to avoid the long post-surgical recovery period. And there is also the possibility of decreasing the likelihood of rapid joint degeneration that can happen when the joint capsule is surgically breached.
And how fascinating! I imagine the dosage might vary based on the patient's age and health, yes?
Older patients need a higher concentration of PRP as their natural healing cells tend to be less efficient than that of younger people. We can tailor these treatments based on age, health status, and the specific injury. We treat the whole joint and other related structures to give our patients the best chance at relief without surgery.
Avoiding surgery, sparing cartilage, all while getting back to the activities they love. I do see why you love what you do, Dr. Deb. It sounds like a win-win situation for your patients.
There are times when a hip replacement is the best option, especially if the joint is severely arthritic or bone-on-bone. And for patients who may not be healthy enough for surgery, or those wanting to address the pain and inflammation if there is a need to delay a future joint replacement, PRP or bone marrow injections can provide pain relief, and they may be able to buy some time instead of turning to steroids, which can further damage cartilage. And these regenerative treatments offer a more sustainable option to steroids, in my opinion.
It seems your approach not only alleviates pain, but also helps people avoid the complications and recovery of major surgery.
Well, thank you, gentlemen. That's exactly why I'm so passionate about what I do. Helping people regain mobility, avoid invasive procedures, and feel better is the most rewarding part of my work.